Is your diabetes controlled, or do you not know?
It's pretty much under control. It's not 100% under control, but it's not like it used to be. It's not through the roof. But I guess what I'm saying is I didn't really know how much of being a diabetic would cause problems with the erectile dysfunction.
Well, Pence, that study that I was telling you about, that penile duplex study, you get one of those, you'll know how much of your disease process is psychological and how much is physiological, and we should be able to, direct you in the proper direction. Are you here in Miami, Pence, or are you out of the state?
I'm in the state, but I'm not in Miami. I'm a couple hours away from Miami.
Actually, if you go to my website, Perito Urology, Perito urology.com, there's a way of finding guys that are specialists in sexual medicine, through that website.
What was that website again?
Perito, P-E-R, P as in Paul, E-R-I, T as in Tom, O, urology.com. And if you go there, there's a bunch of great practitioners of sexual medicine, urologic sexual medicine that they don't mess around. They get you to the diagnosis, get you feeling, get you out there and get you intimate again. Okay?
Right. Good. Thank you very much. I appreciate it.
Thanks for the call.
For those people who are listening to us, if you really don't want to get onto the phone because this is a topic that you'd rather really not even speak about, I just want to let everyone know that we also do have an open chat room tonight. And if you go to our website, which is reality-radio.net, right on the bottom of that first page it'll say chat. You can go ahead and pick us up there. And you can also go ahead and go onto our stream if you'd like, which is also located on the same page. You can watch and see what's going on in the studio. And this way we can take your calls via the website as well.
Doc, let me ask you a question. What's the deal with these pills like Extends, and tell me about that. People are really getting. This
has become like a multi-million-dollar industry.
A billion-dollar industry with absolutely no science behind it. Have you ever seen? I'm sure you've seen it. Have you ever seen the 30-minute commercials for Enzyte? Who are their experts? Have you ever seen it? Ron Jeremy. Who's he?
Right, he's a porn star.
He's a disgusting porn star. So let's put something in front of it.
He is.
He's their expert. Okay, that's ridiculous. All of these pills that supposedly make your penis longer, if you went out and you bought or you went to a urologist and you got an accepted medication, meaning Viagra, Cialis, Levitra, and you took that pill and you divided it into, say, 6, 7 pieces, tiny little pieces, and you took that every day, what would happen? You would hang fuller. Your penis would be fuller. Does it make it longer? No, absolutely does not make it longer. So it will make it appear fuller. Now that's what Enzyte and all those products have. They have something that chemically similar to the chemical compound in those pharmaceutical agents I just described, where they have some things that aren't quite that safe, quote unquote, safe. So, to me, you're throwing your money away. You could be doing it safely with stuff that's been,
So what
tested.
is it? What is tested? What does work? I mean,
well, that's what I just said.
Yeah.
If you wanted something to make you fuller, nothing makes you longer. The one thing that you do need to know is once you're rendered impotent. Let me ask you this: if a guy's rendered impotent in a day, in a year, how much shorter do you think his penis will be?
I don't think so. Not any shorter.
You don't think it'll? Yeah, you don't think it'll shrink, Doc?
If he's impotent?
Yeah.
I would think from lack of use it would shrink.
It's sort of like the rose goes,
Yeah, it's going to shrink. Now, unlike a muscle, that if you let a muscle atrophy, that muscle can come back to its original size.
Yeah.
Well, the tunica, the lining of the erectile bodies in the penis, once that goes, your penis starts to shrink. And the numbers are very well documented. They're 0.5 to 5 centimeters every 18 months once you're rendered impotent. Now, 5 centimeters on a penis is like 30 feet on a boat, right? I mean, it's a lot. Okay,
that is a lot. 5 centimeters, yeah.
So,
what would that, Doc? What would that be? Would that be like a canine and a molar or something?
Look at this. You have it's 100 millimeters are in one of your little cigarettes. Okay.
Okay.
So a centimeter is,
You don't have to get snotty about it.
so, you know, it's substantial.
Wow.
It's substantial.
Go ahead, Doc. Keep
Now,
going.
but that is really, that's an essential fact for somebody to know. And for example, we haven't talked about penile implants. I don't know if anybody.
Oh,
will call.
we're going to talk about those.
If anybody will call, but if you go online and you read, you know, things about penile implants, it'll say that the penile implant makes your penis shorter. That is absolutely false. What happens is your impotency makes your penis shorter, and the longer you wait to treat it with whatever modality you choose, the shorter your penis gets. So guys remember what they used to look like when they were 20. And so you put an implant in them after they've been impotent for 4 years and they've lost 5, 6, 7 centimeters.
That's a couple of cigarettes.
And it's at least a couple of well-burnt cigarettes.
Well-burnt cigarettes.
So you know, that's not the process that occur. I mean, the process that occurs is impotency leads to a shorter penis. Many disease processes lead to a shorter penis. So it's the one thing I'm really, you know, excited to work on with my father, who's a psychiatrist, is you know, studying what is this fascination with a big penis, because that is across the board. Every single culture has that fascination. Now I happen to suffer the consequences of men that as they lose it, you know, it's not pleasant taking care of these patients. And it makes it difficult to deal with these patient satisfaction levels. And, you know, acceptable patient satisfaction levels for a patient, for example, who's got something called Peyronie's disease that makes it curve. They're just unhappy guys because they've lost so much length. So really, to summarize, if you want to be a happy patient and you got a problem, you better get to some urologist and get there quick, because the longer you wait, the shorter you get.
The longer, that's right.
You know, and it's funny because particularly when you're talking about problems with the penis, how can I put it? I mean, I could have chest pain and I'll go, well, you know, this may go away. You know, if I have a bump on my